This is Manzoor Memon from PBC TV network. Today we are going to talk about mental health. The stigma of mental health is still present in our society, but people are in denial. Many people think it is the witchcraft, voodoo, or evil spirits. Many of these cases, if diagnosed right, can be cured. Society needs to recognize the epidemic of mental illness, no matter by genetics or circumstantial causes. Our fast-paced, stressful lives, broken families, social and economic misbalance, and post-war trauma has put a large number of people in depression, fear, anxiety, and PTSD, which has created multiple mental issues. Government on local and national level has given very minimal support to this issue, which is the major cause of crime and jail overpopulation. Open purchase of guns and ammunition is adding fuel to fire, which has created fear and anxiety of crime in general public. If we can divert funding from the criminal systems, building jails and court systems instead of spending the same funds to cure mental illness, we can create a safer and better society. Today we are going to interview an expert on this field. Let me introduce you to Dr. Asim Shah. Dr. Asim Shah, nice meeting you, and thank you for giving us time. I would like to give you a little background for Dr. Asim Shah. He has done MBBS from Dow Medical College, Karachi, Pakistan. He did his residency at Delaware State University. He is a vice chair for community psychiatry and professor of Manager Department of Psychiatry in Baylor College of Medicine. He is the chief of psychiatry in Harris County Health System in Bentop Hospital. And he has a lot of, his resume is so big that it will take a long time, but he is, in my view, an expert on mental health.
Thank you.
Dr. Asim, thank you again for giving us time. Let's talk about discussion on the mental things. First question is that how do you recognize there is a mental issue and how to start working on the people? I want you to, basically our interview is based on the community awareness. So this will be the first thing will be, tell us how the people can do this.
Sure. So first of all, thank you for coming. Thank you for touching on this sensitive issue and sensitive topic. It is sometimes very easy to recognize mental issue, and sometimes it is very difficult. Why I say that? Because if you are looking at the signs of mental illness, it could be very easy. But if you're closing your eyes, it could be the most difficult thing. What I mean by that is that signs are very simple. So for example, a person who has any sort of mental illness can be a person who has withdrawn from the community, meaning depressed, can be a person who's not going out in public, can be a person who's not participating in day-to-day things, can be a person who's not socializing, can be a person who's not trusting people, can be a person who is not sleeping well, can be a person who's not interacting well. So when a person is not doing things which you and me or normal people are doing, those would be the common signs that there is something wrong. You may not be able to know what is wrong, but if you start
So what you're saying, if you see these symptoms,
Correct.
you need to start
you
recognizing
need to start
it
recognizing
and work on
it, collecting the data, and maybe talk to a professional.
Okay, tell me something. What do you think as the expert on the mental illness? What are the basic causes? Are they genetics? Is it a social problem or school bullying? What are the major causes in your view that these illnesses are coming surfacing?
A lot of time people used to think, for example, think about the most common mental illness, which is depression. People used to think that depression only happens if your social situation is bad, meaning if you're poor, you will be depressed. If your home situation is not well, you will be depressed. If your marriage is not well, you will be depressed. We now know that depression is of two kinds: endogenous depression, exogenous depression. Endogenous depression is what comes from inside, meaning everything around you is good. You have good family life, good wife, good family, kids, money, everything. But your neurotransmitters have a problem. You have a chemical imbalance. You will be depressed. So in that scenario, that is not your circumstances, environment, in that scenario, it's a chemical imbalance.
That is curable.
That's curable, which is endogenous depression. Exogenous depression would be when your environment is a problem. So that's one. So depression, which is the most common mental illness, cannot be only because of your circumstances. Number one. Number two, if you're thinking about genetics, I always joke and say that everything runs in family. We always think that only money runs in family. No, all illnesses run in family. Your diabetes, your high blood pressure, your asthma, your dementia, your depression, your bipolar, everything runs in the family. But illnesses run in the family, but you need to remember, illnesses run in the family to a certain extent. So if your father was depressed, your chance of being depressed may be 10%, but the other 90% is you may not be depressed. So don't focus that you will get that illness. You may not get that illness.
Okay, tell me something. What is the difference between clinical depression, schizophrenia, and bipolar order disorder?
So let's just go one by one. First of all, talk about depression. There is one thing called clinical depression, and there is another thing called situational depression. Clinical depression is a depression in which a person is depressed for at least 2 weeks, and in which the depression is causing functional impairment, meaning the person is unable to do things. Person is unable to go to work or do things. That's called clinical depression. Situational depression is you're depressed because you may lose your job, you have a divorce or something. Now, some divorces, people are happy, as you know. It's a different thing. But that's a situational depression.
Situation,
because of the situation.
With the situation changes, it goes away.
Like a 17-year-old break up with a boyfriend, they're depressed, next day they get another boyfriend, they're happy, that situation. Bipolar, as they say, bipolar, two poles. You're too happy, then you're depressed. Bipolar. So you can be manic and then you can be depressed.
But is that chemical imbalance?
That's chemical imbalance, but the chemicals are different because in depression, your serotonin levels are low. In bipolar, when you're depressed, your serotonin is low, but when you're happy, your serotonin is too high. So that's bipolar. And the third thing is schizophrenia, like you mentioned. Schizophrenia is also chemical imbalance, but it's a dopamine problem, which causes you to be suspicious of people, which causes you to hear voices, see things, and that's a different spectrum. So they're all chemical imbalances, but different chemicals are involved, and they're completely different spectrum diseases. Now, bipolar and depression are sort of similar because bipolar includes depression in it.
But what symptoms the families should be looking in their kids or their family members, siblings, that will
let's just talk about few common psychiatric disorders, and I'll give you just one symptom for each disorder. Just one symptom for each disorder, because if I give you 10, nobody's going to remember. So if you think about depression, one symptom which comes to your mind or should come to your mind is lack of interest. Think about depression. Anybody with depression, how can they have interest in things? If you're depressed, you won't have any interest in things. So depression equals lack of interest. Mania. Mania is too much energy and inability to sleep.
Sleep is the key.
Lack of sleep and too much energy. Because if you're manic, you have too much energy. There is no way you can be manic with no energy. Anxiety. Third thing is anxiety. So if you have anxiety, the key symptom of anxiety is worry. Meaning you worry. So that's anxiety. So fourth is schizophrenia. If you think about schizophrenia, the thing which comes to your mind is odd behavior. Suspiciousness, hearing voices, odd behavior. Okay? So think about that. If you think about dementia, what comes to your mind? Short-term memory loss. Not long-term, short-term memory loss.
What you ate 15 minutes ago.
Correct. Now, people say, oh, my father, his memory is so good, he remembers what happened in 1960. That's not the question. Does he remember what happened last week? Or yesterday? No, he doesn't. So that's how you remember.
But is that a mental disorder?
Yes. It's a mental disorder. But it's a neurocognitive disorder because psychiatrists claim that it comes under them. Neurologists claim it comes under them.
Okay. So when the patient comes to you, what test you can do it to diagnose this? Are there some tests?
Yeah. So
blood tests or
psychiatry is a unique field in the sense that there are very few tests in psychiatry. We do most of the stuff without test. So we do most of the stuff with history taking. Although we have few tests available, but very few. So for example, for dementia, theoretically, you can do a PET scan, a scan of the brain, PET scan, which is 4 or 5,000. Insurance may not cover it. So we usually do history taking and we diagnose it like that. But most of the time we do it by history, and we're looking into different tests, but most of the time it's by history. So we don't depend on the test. If you go to a cardiologist, they diagnose everything by echocardiogram or EKG. If you go to a GI doctor, they do scopes. Everybody do these things by testing. We do everything by history.
But is it because of the cost?
No, because there's no really good test available in our field, and that's how we do it.
Okay.
Or we can say we are smarter now.
Then the problem is this: the doctors are basically using the medicines like on a trial and error method, and they're basically just giving the pills to people to calm down, and because don't see the medications or helping the people to stabilize.
You raise a good question.
Yeah.
I can give answer to that in two ways. So if you go to a primary care doctor and you say you have throat pain, they give you an antibiotic. That's also trial and error. They don't know which antibiotic is going to work.
Okay.
How do they know? They haven't done a culture sensitivity. That's the exact same thing you are mentioning here. Or if you go to a doctor for diabetes or high blood pressure, they give you one medicine that doesn't work, they change it. Same trial and error, they don't know. If you go to a doctor for cholesterol, they give you one medicine, doesn't work, you have side effects, they change it. So in all medicine fields, it's almost the same. Now, granted, we have a test available now, which is a assay. We have a test available, gene site testing, which you can do, and some insurances are covering that test, which gives you a whole report and says, patient so-and-so is sensitive to this medicine, this medicine, this medicine, and this medicine is going to work. That test is available. And some insurances cover that. And some insurances don't cover it. So it is available, so we can do that.
So in your view, as an expert, you would rather have diagnosed it, which medicine will work, rather than just keep on trying it?
It's not keep on trying. So first of all, when we start, for example, a patient comes to us, we will start medicine A. We usually see the patient in 2 weeks after we start a medicine, usually. So after we see a patient in 2 weeks, why do we see the patient in 2 weeks? We see the patient in 2 weeks not to see if the medicine is working, to see whether the patient has any side effects or if the patient is getting worse. So a lot of time they're getting some benefit. So that's one reason. And a lot of time patients, I think the biggest challenge in our field is that the diagnosis continue to evolve. So in your first visit, patient gives us information about diagnosis and we say you're depressed. We start you an antidepressant. The second visit, patient gives you more information. Third visit, the wife comes and says, oh, this person cannot sleep for the last 3 weeks. He spent so much money.
People are not honest with that.
Exactly. He spent so much money and he's full of energy, and you change the diagnosis to bipolar. Now your medicine changes. So everything changes. So that is the reason you change. So that doesn't happen in the first visit.
I see. But tell me something. Is there more focus on the medicines, or there should be more focus on the therapy?
So we used to have a lot of focus on therapy, which is shifting towards medicine for two reasons.
Right.
A, therapy is good if you have therapy once a week, every week, for 16 weeks, 20 weeks. Number one. Number two, therapy is good for depression and for anxiety. Therapy is not good if you're schizophrenic, necessarily. Therapy is good if you're doing specialized CBT. A lot of therapists these days are doing therapy and they're not specialized CBT providers. If you're doing therapy once a month, that's not necessarily going to change the course of your illness. And second, these days we have better medications available than we did before. In the past, we had Prozac. Prozac used to take 6 weeks to work. Now we have medicines which work in 3 or 4 weeks, so half the time. So you have quicker medicines, better medicines, which work quicker, and therapy you're doing once a month. Once a month therapy.
There's a lot of side effects here.
Not every medicine has side effects.
Because a lot of medicines I heard they go through the liver, and then you get liver
So,
problems.
very good question. Very good question. So, in psychiatry, every single medicine goes to the liver, except for few medicine. None of them stay in the liver. Going to the liver doesn't matter. Every medicine you take goes to the liver. Going to the liver is no problem. It is a problem when they stay in the liver. Only few medicines stay in the liver.
Okay.
The issue is psychiatrists usually tell the patient that your medicines are going to cause a problem. if you go to other doctors, they don't even tell you what the medicines are doing. When you go and see your primary care doctor, you take a cholesterol medicine. How many times they tell you that your medicine is going to go to the liver, it will destroy your liver? Do they tell you that? No.
Yeah, that's a major
So
problem.
that's the problem. We tell you that. That's the reason people worry about it. But other doctors don't tell you that.
Okay, let's go and shift a little more on the many parents, they hide these cases and they try to keep their siblings in the closet and don't bring them in society to get better. What they should be doing rather than keeping their kids or siblings in the closet and hide them from society. What will be your message that what they should do?
Yeah, I think the first thing is that parents, family members need to understand that mental health illnesses, psychiatric illnesses are completely normal. Being depressed is completely normal. Having any psychiatric illness, there's nothing wrong about that. If you have a psychiatric illness, you have a psychiatric illness. What's wrong about it? So first of all is acceptance. Because once you accept, then you need to let your family members accept, and then go out in family and do as is. Because we have that stigma, oh, you're depressed, it's bad, or you're anxious, this is bad. We need to remove that stigma. Because once we remove that stigma, we have that acceptance, then we can let other people know, and then there's no problem with it. The reason we have that closet mentality is that since we ourselves have stigma, we don't want to share it. Because, oh, no, how can I tell people that my so-and-so has depression? Because that's bad.
Yeah, because they feel that they are a failure as a parent.
They feel they're a failure, or somebody will look down at them.
On them, yeah.
That's not, no. We need to remove that stigma.
Yeah.
There's nothing
and
wrong
it's
with it.
hurting those patients.
Exactly. It's hurting those kids.
Like even President Reagan, I understand, had a depression. There are a lot of
depression, he had Alzheimer's. What?
And then they ran the country, like such a big country. They ran.
My grandmother had Alzheimer's dementia. At that time, we didn't know.
Yeah.
Now I know that she did. Now my mother is suffering from dementia.
That's it.
But
they had a good life,
Yeah,
so the
what can
people
you do?
need to get this message that, it's just like you have got a blood pressure, okay? You are not going to stop living. Yeah, you are not going to stop living because you have a blood pressure. You
Exactly.
balance it and all that, You said about the social acceptance. Social acceptance of these patients is a key problem in my view. They get secluded, they go deeper in problems, and there are there any groups where these patients should go and share their thoughts and get a group therapy in a state or a county level?
Yeah.
Do you have some groups like that?
Yeah, we have a lot of things. We have a lot of things in Harris Health level also. We have groups here at Harris Health level. We have CBD groups, DVD groups. We have groups for people who have schizophrenia and others. But then at community level also, there are different groups available. There are different caregiver groups also. So if somebody has substance abuse, there are groups for caregivers. There are groups for bipolar. There is a depression bipolar support group also, DBSA. So there are different things available.
So there are, but
yes.
people don't know about
People don't know.
Yeah.
There is a DBSA. I'm actually a board member of DBSA, depression, bipolar support.
So what they need to do to join those groups?
So they're free. You just Google DBSA, put DBSA, Depression Bipolar Support Alliance, and anybody can go to those. You can be actually a facilitator for that group. Because first you go and attend those groups, and if you think you have the capability, you can be a facilitator of those groups. And that gives you a lot
Just
of...
like alcohol anonymous.
Yes, it gives you a lot of,
Tell the people your story
Yes,
and all that. I
exactly.
think one thing which I've talked to so many of these. My wife is also helps this kind of people, and there was a good story I want to tell you that this one boy, the parents had just kept him in a closet, and one day the boy, we were walking, and somebody asked him, why are you not getting married? Because he did not know that he has some issues. And so he kind of got a thought about that and went home and talked to the parent that, hey, how come this person having problems and, he got married, he has 3 children, how come I cannot get married? So I think the parents, they kind of woke up from that closet and they said, and then they talked to me and I said, yeah, that would be a great idea. And can you believe it? They took him, they got him married and he's expecting being a father. And I think it's going to change his life. And the people need to get out of the closet.
Yeah, Yeah.
and do.
But not everybody has good family support and social support also.
That's a key thing. Is
Exactly.
What you said.
Because you don't want to do that if you don't have good social support.
Yeah.
Because otherwise you will get married and you will have kids and nobody there. So you need to look into all the dimensions.
Okay, tell me something about this. Besides medicine, medication, therapy, there's a new technology of ECT, what they call it, convulsive therapy. Can you shed some light on it and the treatment? Tell us the benefits and the side effects of it.
Sure. ECT is actually not new. ECT is an old technique. It's a very old technique. And to me, ECT is one of the best techniques. So if you think about it, antidepressants work about 44% of the time. They don't work the rest of the time. ECT works about 80% of the time. So it's almost double.
Okay.
Yes. But yes, ECT is invasive because you give kind of electroconvulsive shock therapy.
But how much volt you get?
It's a very low voltage.
Yeah.
But the problem is people watch that One Cuckoo's Nest movie, and because of that, they have that stigma. Yes, and they have that stigma, and they feel that it's going to be shock and all of that. But it's very mild. But there are some side effects, which is you lose a little bit of memory for some time, and you have to have ECT again and again. Now there is another treatment which is out in the market also, which is ketamine. Ketamine. Ketamine is something which we are doing research on right now. Actually, at Bentov, we did research in 2010 also. Right now, we're doing intranasal ketamine, which works 70% of the time.
Okay, what does that do?
Ketamine is an anesthetic agent. It works almost the same way as ECT, very quick, and it doesn't have the side effects as ECT. So they both are very good treatment options for depression. And ECT is a great option. Ketamine is also a good option. These are new treatments for depression. ECT is old, but ketamine is a new treatment. And those could be...
So what, they inject something?
Ketamine is intranasal. So you just do a nasal spray.
Okay.
And after first nasal spray, people start feeling better.
Okay, so what does it do? Basically, they trigger the neutrons?
No, it basically gives a euphoric effect. Just like when you give anesthesia works immediately, sedates you.
Yeah.
It works on your NMDA receptors and it causes euphoria. Euphoria is happiness. So it causes happiness and the happiness lasts for a long time, and then a day after tomorrow you come back and have another one.
Okay. So now you got this, what you call it?
Ketamine.
Ketamine. So
it's actually used for dental procedures.
Oh, I see. So we got a ketamine, we got ECT, and then we got medicines.
Yes.
Now, as an expert, what do you recommend out of three of them?
Obviously, if it's mild depression, medicines is fine. If it's severe depression, you can go to ECT or ketamine. Ketamine is still not out in the market.
Oh.
It's still in study phase, only for depression. Some people are using it off-label, but otherwise it's in study phase. So ECT is available.
Okay. Let's talk about the children. In the schools, they've got psychiatrists in the schools, and never had it in our time. And
they're counselors more so than psychiatrists.
Yeah, no, I've seen in the
some
but
maybe
they are counselors, and they've been putting these young kids on medications right from the beginning. If some kid is hyper, there are always aggressive kids, and they're putting them on these, just trying to clamp their capabilities. Do you recommend this kind of behavior in the schools? That putting these little kids on Zoloft and all these medicines?
Yeah, the ideal treatment for kids is try without the medication. Now, if you have to give absolutely different, but otherwise try without the medications. The first line is no medication. Having said that, sometimes we do give medication.
Discipline them.
Discipline, therapy,
counseling,
therapy, but we try without the medicines. Try. Now, we may give medicine, but not the first line, not the second line, but maybe the third line. So, but a lot of times, by the time the patient comes to the psychiatrist, it may be the third line or the second line, I don't know. But not the first line, you should start medication. So you should wait. You should start.
But what I'm seeing is that a lot of kids, they have some social problems, family problems, financial problems and all that. That is the cause of their being hyper. And instead, the counselors looking into the history of this person, okay, which family he's coming from, what is his problem. Maybe he has no lunch money and he's depressed because of lunch money and he's fighting on snatching money from somewhere else and all that. And end of the day, we think that these people are a threat to the society. And so, in my view, what that these people are doing is put them on medicine, just make him sleep.
And part of that is that a lot of time teachers also complain that the child is having this issue and that issue, and because of that also. But truly, the answer is start with therapy, start with psychotherapy, counseling, and if needed, yes, some of those kids may need medications. Agreed, not all of them.
Yeah, if they have the chemical imbalance and they get them tested.
Not all of them.
Okay. Let's talk about suicide. And in your view, we have got. I don't think government is supporting the mental illness so vigorously as they should be. In my view, they are putting more focus on their criminal systems and jails and all that, and put these people with mental misbehavior issues into jails rather than giving them treatments. They are putting more money into that rather than in the mental illness clinics and all that. And then we've got a lot of suicide rates. So what is your message on, particularly on the suicide, that how can we can address that issue?
If you think about suicide rate dropped till 2000. Now it's back up.
Why?
So it's back up because truly we didn't do a whole lot. US is the number one country when it comes to guns in the whole world. Half of the suicides are committed by guns. Half of the suicides.
Okay.
Everybody talks about guns and violence and guns and terrorism and this and that. Nobody talks about guns and suicide. This is all political. But half of the suicides are completed by guns. Only about 20% suicide to 25% suicides are completed by overdose. But about half of the suicides are completed by guns.
Gun. Okay.
Why? Because if you try suicide by gun, it's a lethal method. There's no survival.
Yeah.
You're done. Right? So half of the suicides are completed by guns. Every 12 minutes, there is a completed suicide. Elderly white male is the highest risk factor for suicide.
Whoa.
Elderly white male is the highest risk factor for suicide. Okay? And while married people have lesser incidence of suicide because they're future oriented, suicide risk is very high. Religion gives you some protection because if you're religious, whichever religion you are, every religion looks down for suicide.
Yeah.
But you know and I know, so many people are becoming agnostic, atheist, not observing religion, which means that their view of suicide would be different. Okay. Psychiatric illnesses, whether it's depression or bipolar, there's a 20% risk of completed suicide. 20% risk. Schizophrenia, 10% risk of completed suicide. Personality disorder, 10 to 15% risk of completed suicide. 2014, 2015, over 40,000 deaths in US completed suicides.
And with guns.
No.
Most of the total.
Total.
Yeah.
Out of them, half of them with guns.
But
yes.
if they restrict the guns to
Half of
people and...
It's not that. Again, the purpose is not to make all or none decisions. We're not saying restrict the guns. We're saying make it difficult. We just change it, even made it easier.
Yeah.
Again, the purpose is never to make absolute decisions.
Yeah.
I am never a proponent of making anything absolute. You cannot. But make it difficult. Make more checks. Right? Why do you have to have easier access to them rather than difficult?
Recently, there was a case in which this young man, he had some depression issues, and I don't know how he got the gun, and he went and shot himself.
We even decreased the price of getting a license for guns. So cost of getting a license. So we're making it easier and easier rather than difficult. And access to mental health.
Yeah.
If you're depressed, do you know how long it takes to get an appointment with a psychiatrist?
No.
Even if you have insurance?
No.
First of all, good psychiatrists in this area don't take insurance.
Okay.
They don't take insurance.
So
They only take cash.
Okay.
So that's one thing. Second, if they take insurance, it will take you 3 months or so.
Wow.
We are very lucky in Harris Health, and I'm very proud to say that if you are in Harris Health, we will give you an appointment at Bentop within a few weeks.
Wow.
Absolutely. I'm very proud to say because we have made it a priority to do that. We have made it a
In
priority
case
to do
of
that.
emergency, you take...
In case of emergency, we will absolutely see you.
See.
Yeah, but otherwise in the city, it is that bad. Imagine if you have chest pain, heart attack, you want to see somebody in 3 months,
Yeah.
you will be dead before that time. So those are real problems, and nobody wants to touch that. This is a serious issue.
What's your final message for the community?
Final message is please take mental illness as a serious illness. This is more serious than your heart illness. Why? Because everything goes through here. Okay? Don't take it lightly. Don't take people who are avoiding. Look at the warning signs. This is a serious thing, and please accept them as normal.
Accept them and come forward, and then you
come forward. Come forward. Talk about these things. There's nothing wrong about it.
Get some help.
And anybody who comes to my office, people used to think that, oh, if you're a psychiatrist, you will see people who have mental problems. There's nothing like that. I see throughout the day people who are completely normal, more normal than you and me.
Sometimes even the normal people do.
Absolutely.
Exactly. Abnormal here.
No, don't even call abnormal. Normal people can have anxieties too.
Yeah, I know. Yeah. So they need to come and get it. Yeah,
they are more braver than other people
Yeah.
because they are getting help.
Yeah.
Other people may not be brave enough to seek help.
Yeah. Seek help. The conclusion will be that if you have any issues in your family, any of your kids, siblings, that you have a problem, recognize it. And after recognizing, seek help. I think we are in the best country in the world,
Absolutely.
in which there is so much medical facilities available. And Dr. Asim has been. I've seen him in action, helping the people. And I think if you need any help, give us a call, and we'll try to help you also on that. Thank you very much for listening, and we'll be talking to you.
There's a crisis hotline. Anybody can call 1-800-273-TALK. 1-800-273-TALK.
And somebody will talk to you and
There's a crisis
help you out.
hotline.
Crisis hotline. But that's an excellent idea too. At least those young kids. If you have a problem at home, I think it will be a good idea. And we'll put this phone number again on the screen:
1-800-273-TALK.
273-TALK. Talk to the people. They will try to guide you through that. Maybe you have these small issues with you broke up with your girlfriend. You have small issues, and don't get depressed on the small issues, because there is a big horizon open for you to go and do something positive, and the things are going to change for you. Because if you are not going to work hard, you are not going to come out, those things are not going to change. So don't be in the closet, come out, take some positive steps and change your life. Thank you.